Hey AJ, tomorrow is our return timer for Pija. Do you already know how to perform those procedures?
Of course! Not! But I'll just watch video from YouTube.
That's a great idea.
Yeah.
I think I'll search the umbilical cannulation and I'll teach you afterwards.
Okay, I'll watch the orogastric insertion and then let's help one another.
Sounds good.
Are used for newborn infants that require resuscitation with IV fluid and or medication. The equipments needed are sterile gown, gloves, mask, sterile drapes, umbilical catheter, 3.5 or 5 French, iris forceps without teeth, small clamps, scalpel, scissors, needle holder, silk suture or umbilical tape, IV tubing, 3-way stopcock, and betadine swab. Attach the stopcock to the catheter. Attach the saline tube to the opposite side of the stopcock. Flush the entire system with saline solution to clear all the air before recapping the middle port. This is done to avoid creating an air embolism. First, use cotton tape to form a knot at the base of the umbilical cord. Ensure knot is just tight enough to occlude the blood flow. This is done to avoid bleeding from the umbilical cord once the cut is done. Use a scalpel or scissors to cut the umbilical cord approximately 1 to 2 centimeters from the base of the cord. Attach a hemostat at the edge of the umbilical cord to stabilize it for insertion of the French catheter into the vein. The depth of insertion should be around 3 to 4 centimeters. Note that the first marker of the catheter is 5 centimeters. Flush 0.5 to 1 ml of saline solution. Secure the catheter line itself by creating a loop, placing the tegaderm over the loop but not over the umbilical cord. Cut the tegaderm based on the size of the infant.
Is indicated for stable low birth weight babies who are not able to accept breastfeeding or feeding with spoon. In orogastric tube feeding, you need feeding tubes, syringes to measure the correct amount, stethoscope, measuring tape, and scissors. Before inserting the gastric tube, first wash your hands. Then estimate the length of insertion by measuring the distance from the bridge of the nose to the earlobe and then on to the infant's abdomen between the xiphoid and umbilicus. Note the reading on the orogastric tube. Flex the infant's neck slightly. Pass the tube gently through the mouth. Once the required length is inserted, fix the tube with adhesive tape. To check the position of the tube, by aspirating the contents of the stomach and see if it looks like curdled milk. Measure the required amount of milk using the clean syringe. Remove the plunger of the syringe and connect the barrel of the syringe to the end of the gastric tube. Pinch the tube, then fill the barrel with the required volume of milk. Do not force milk through the gastric tube by using the plunger of the syringe.
Okay, class, we will be having the return demo today. So I hope you did your job to know the procedures. Let's start.
Good thing we studied the procedures.
Yeah, you're right. Thank you, Carlo and AJ, for teaching us.
Thanks to Carlo because he reminded me that we will have this activity. But I hope I won't be called first. My gosh.
Okay, Mendoza.